We're really excited to have 3 and maybe even 4 options for patients in the class of drug called PARP inhibitor. It's important because these drugs, while from an efficacy standpoint, all seem to be pointing in the same direction and are confirming the overall efficacy, there are definite patient characteristics that interact with these specific drugs and the side effects that some of them experience that really will help us, I think, in the future to identify how do we narrow that selection. But we need the menu so that we can actually deal with questions like, for patients that have difficulty taking pills, once a day might be good. For patients that have problems with bone marrow, a drug that doesn't have a lot of bone marrow toxicity or can be modulated in an easier way. Some people have more nausea because these drugs are metabolized in a slightly different way. Some patients have higher degrees on their, more effects on their creatinine clearance or creatinine values, even though they may have normal creatinine clearance. So these are subtleties that come up on all of the trials that we've done for patients who receive the drugs. And I think the most important thing that we'd like to get to is that these drugs are administered daily because they have short half-lives. So what's most critical is that patients stay on them and not take breaks. And so sometimes retooling the drug, changing them, making it optimized to the patient is the best option to gain the most benefit out of the drug for the long term. We are excited now because the work that's come from the single agent experience with PARP inhibitors has allowed us to dig deep into the DNA damage response pathways, and now we've identified a whole number of new potential targets where we can move this drug further. So I think that potentiation, identifying the types of patients that are best going to respond to a single agent versus a combination. What do we do when patients have a recurrence and become resistant to the therapy? And can we use it again in the future? Coming up with a dynamic tool to sort that out is really one of the major, I think, next major discoveries that we'll need to see in the treatment of patients with ovarian cancer. But the opportunity to leverage this specific aspect into additional therapies that'll either be in combination or in response to and sequence is really has set off a lot of investigative energy as we move forward.